Okay, let's get started. Hello, Dr. Mullings.
Hi, how are you?
Good. Welcome, welcome. I'm going to read a quick little bio of yours and then we're going to get into some questions. Here's Miss Natalie. Let me let her in. We're getting into some questions. Um, well, first of all, you are my ENT and you have been a godsend to me through my menopausal journey with all of my sinus issues. But let me introduce you first, which is that you specialize in the management of all sinus and skull-based diseases, which I thought was quite interesting. You use the latest endoscopic equipment to restore breathing, relieve facial pressure, and improve smell by clearing inflammation and tumors from the sinuses. What I loved about this was you're currently the only North American fellowship trained sinus surgeon practicing in the English speaking Caribbean.
Yeah, that just changed a few months ago. So I need
Yeah.
to adjust that because
I love
a good
that.
colleague of mine just trained in Miami and is now in Trinidad. So I'm really happy for him. So
Oh my God.
he
That's
joined.
amazing.
He's a great guy.
Congrats. Okay, well, welcome, Dr. Mulling. So today's topic, as I said, is really, really important because as we know, menopause we have estrogen receptors in our entire body. And for me, and I will just start off by saying that that was mine. I did a video on this morning that was my, if you remember, that was my first telltale or first symptom that I had when I started my perimenopause journey, which was it attacked my sinuses. And I was living on antibiotics. You and I, we did scans. We just couldn't figure out, and it was until I came to you and you were like, it does affect your sinuses, the estrogen and the mucous membranes and stuff. So I thought this was super important because a lot of women don't know that this is true, that this can happen. And especially in today's day where everybody has something. We either have a cold, we have a flu, we have a sinus infection,
Mhm.
and we're living on antibiotics, we're back and forth with the doctors that maybe for some women they need to go and check your hormones. Maybe it is like what I went through. So we're going to be trying to understand the link between menopause and sinus issues, allergy and sinus issues. So let's just start off with that is why? Why do so many women, myself included, have this change during menopause, especially during menopause or heightened during menopause? What is the connection there?
Well, thank you for having me. It's really good to be here and to talk about an important topic that isn't spoken about a lot. And to be honest, a lot of the research is lacking in this area, but we do know some things. And one of the things that we know is that there's actually a difference in the sex hormones and the impact of the sex hormones between men and women, just to start off. That we know that the pathway in inflammation, so a lot of it gets a little technical in the details, but we know that men have higher testosterone levels, women have higher, that comes from the testes, and then women have higher estrogen and progesterone levels, and that comes from the ovaries. But of course, men will produce some of the female sex hormones from the adrenals, and similarly, women testosterone from the adrenals. And what we do know is that there are receptors, or let's call them receiving um, areas in the lining of the nose and on the immune cells for these sex hormones. And then from knowing that, we know that variations in your sex hormones will have an impact on the health of your nose, sinuses, and your immune system. So if we extrapolate from that, any significant variation, so in the human body generally, we like things to be balanced. Homeostasis is what we call it. But basically, we like things to be balanced and to be even Steven generally. And that's when we work best. And then things definitely get off kilter whenever we have a major change in that balance. And so we know that during a period when we call I'm trying to avoid the big terms, but when the signals from the brain goes on down to the ovaries, so we call that the hypothalamus, pituitary, ovarian axis. But at the end of the day, when the brain tells the female hormone organs, to produce how much hormones that we need at a particular period of time. And when that axis falls off or transition, so we call it menopausal transition. So when you're going through the perimenopausal stage, 10, the years before you actually stop your period, stop having your period. And that variation in change, we see physical manifestations of that within the nose and the sinuses. So people become a little bit more sensitive to allergies that they may be exposed to, or their immune system doesn't work as it would in the past in protecting you against certain irritants and allergens that you might be exposed to. So a lot of it is extrapolated from animal models. So a lot of it isn't well understood, to be frank, but appreciating and knowing that there is variations in your hormone levels, and that certainly can have an impact on your sinus health is important to at least appreciate. So at the end of the day, there are receptors on important cells in our body that controls um, the way in which the cells work.
Gotcha. I thanks so very much for that, Dr. Mullins. I have a question just to dig a little deeper into that. So we do know that there are estrogen receptors all around the body, right? And this is why, we know that there's well, everywhere. So to specifically talk about the ones in the sinuses, if we have estrogen receptors in the sinuses, and our estrogen production starts to fluctuate and ultimately decrease in perimenopause and menopause, how does that decrease in the hormone heighten your sensitivity to getting more allergic responses?
Right. So the variation changes. In some women, they tend to have more sensitization. Some women have drier, thicker secretions, and so on. If we go back and we understand that within the lining of the nose, there are receptors. And we know that when your estrogen levels are higher, then the amount of receptors, what we call the density within a small area, actually increases. So we know that there are certain types of receptors called muscarinic receptors. Fancy name, but there are types of receptors that are easier called muscarinic receptors. And they're actually receptors impacted by progesterone, which is known, those are alpha antagonist receptors, but they're receptors. And we know that whenever there's variation in your hormone levels, so for example, if you become pregnant, or during your menstrual cycle, what will happen is that they become a lot more sensitive during that period of time. So a woman will say, oh, when they're pregnant, their sinuses gave them a hard time. They're really congested. They became more, their receptors were so much more that the side effect is that they produced more mucus and they had more inflammation. And so the secretions and the congestion increase tremendously. It's not only due to the receptors, because there's increased blood flow and other hormones during pregnancy that has an impact, but that's one of the impacts that it has. So we also recognize that whenever your hormone levels fall, similarly, it has an impact. And interestingly, one of the impacts is that your nose can become a lot more drier, just like how other places become drier, the nose can become drier, and the secretions become a lot thicker. So people say, you know what, their nose is not running, but they lie down at night and then they get this glob that drops down the back, and it's thick and heavy. And that's because the secretions will stay there for longer, and they're harder, drier, and they're thick, and they just fall back. And that becomes quite distressing for many individuals. And also, we do know that there are certain types of immune cells in our body called eosinophils. And eosinophils are they're basically part of the body's defense mechanism. And there are factors that will cause eosinophils to rise, and there are factors that will cause it to be controlled, to be reduced. And here we go again with balance. You want pro-inflammatory and anti-inflammatory balances, which are important. And then what we find out is that in the control of the inflammation is impacted when our hormone levels fall off. So there are, in fact, these what we call SPMs, or specialized pro-resolving mediators. So basically, you have inflammation, lots of it, with eosinophils that are all over the place. You're inflamed, you're exposed, your defenses are up. And then what can often happen is that the estrogen helps to control that inflammation by producing these SPMs. They're called resolvins and lipoxins, big names, but they produce more of those, and that helps to control it so it doesn't get too exaggerated. In menopause, you lose that check balance, not lose, it becomes less active, less efficient. And so you may have ongoing inflammation, and that ongoing inflammation leads to ongoing symptom. And so understanding that balance and understanding that not every woman in menopause will experience the same thing, because their hormonal balance is different and the impact of them is different. And they also may have different disease states. So for example, a woman may be going into menopause, but she really had a very atopic experience. In other words, she had a lot of allergies and inflammation earlier on in her life. And so her receptors are many and florid and everywhere. And so the impact in menopause is different from somebody who really wasn't atopic, and then all of a sudden they have a change, and then they said, oh, well, I never had this problem before, but all of a sudden this happened, and they call it, oh, it happened in my adulthood is often, but can be associated with your hormonal changes and just the balance, not only of the hormones, but of the inflammation. Tell me if you can hear me with the music in the background. I didn't anticipate we had some music that came on, and if it's disturbing,
No, man, we
hear
can
No,
me.
hear you
Jeremy, we
just
can hear you.
fine.
Not hearing any music at all.
And your explanation, I know you're being very cautious about being too doctory and sciencey, but I think your explanation is great. It makes a lot of sense. And what I'm hearing from you is that if we were in our, gosh, to say regular, in pre-perimenopausal stages of life, but if we were highly allergic with, a lot of inflammatory response, then, it might even be that in menopause that's heightened because of this is really interesting. The information is really, really interesting. Thank you so much for breaking it down at an understandable level.
Yeah, no, without a doubt. I mean, as I said to you at the start, this is how I manifested my perimenopausal stage was that I think, are you there, Dr. Mullings, or is he frozen? He might have been frozen. Yeah, he'll come back in a minute. But as I was saying to Natalie, I was saying to him that that's how I started. Oh, okay, you're back, Dr. Mullings. Yes. No, it's fine. No, I was saying that that's exactly how I started. As you know, there was a change, and it was this dry nose and the whole change. But we talk about the sinuses and all that. But let's talk a little bit about allergies, because when we talk about, like, say, food allergies or insensitive, sensitive type things, seasonal allergies, would you say that that is also tied in at the same thing with hormonal fluctuations then? Are you finding that women are experiencing, different kind of allergies, not just allergic, but maybe like food allergies and sensitivities?
Right. So absolutely. What we see oftentimes is that they may not have a genuine allergy, which is a specific immune kind of response, but they're in fact far more sensitive to things, or far more prone to irritation to foods that they may have, inflammatory type foods that they may be exposed to, so more processed foods that they may be taking in, and more red meats and so on. And we also find that they may in fact have more sensitivities, or if they had allergies, their allergies are even more hypersensitive, or more acutely stimulated by the allergens that they're exposed to. So I mean, there when you have changes in your receptors and your hormones and the way in which the hormones react. So one interesting thing, for example, is that many people may not recognize that a lot of the medicines that you would have used in the past work specifically on these receptors. So if you are competing with, so your medicines are technically what they're trying to do is compete for these receptors with the hormones. And if your hormone levels have changed and your receptor amount or density has changed, then the medicines may not work as well as they did in the past. And they say, oh, this medicine doesn't work as much for me anymore. And a lot of it has to do with understanding the physiology, which is quite deep and complex, but it really sees the body as a dynamic organ that responds to your change in your environment. And if you understand that, you realize that, things will change throughout different periods of your life. Your infancy and the amount of receptors very different from when you're in your menopausal period and your sensitivities and so on. And in fact, there are a lot of women who will go through menopause and realize that their allergens and their sensitivities have decreased. That can happen, and as well as they can be heightened. So there is no one way in which you would respond, but understanding how they were before they got into menopause, or they went into how they transitioned in their menopausal period, and how they reacted in the postmenopausal period is important to kind of figure out and investigate the way. And then it's also important to not buttonhole, we call it, into menopause, to understand that and when we try to get a little technical, pathways in which inflammation can happen. There's what we call a T helper 1 pathway and a T helper 2 pathway. And we know that testosterone leads you down a T helper 1 pathway in chronic sinusitis versus estrogens and so on are associated with a T helper 2 pathway. And the T helper 2 pathway is associated with a lot of allergies and polyps in the nose and chronic sinusitis and everything. And we also know that, when you're along this pathway, actually checking that pathway and so that it doesn't become too florid is also influenced by estrogen. So changes in estrogen and progesterone impact specifically the way in which you react to inflammatory mediators, we call them. And just the amount, type, and the presence of the mediators change based on your hormonal levels. So when your hormones are dysregulated, big word, when they're all over the place, and then the way in which you respond to your environment changes or can change.
You talked about progesterone. Now, I've never heard of that being brought into the equation. So talk a little bit about that with the sinuses, because I've never heard that the progesterone would have, so talk a little bit about that, because a lot of women, when they do HRT, sometimes they don't do progesterone. So how does that come into play?
reason you don't hear a lot about it is because most of the research is done on estrogens. So we don't really know that much about how progesterone works in the sinuses specifically. We do know that it impacts what we call the alpha antagonists, or the alpha receptors within the nose. And we do know that whenever your progesterone levels change, then the amount and density of the receptors also change. What we don't know specifically is whether or not the research really hasn't said that estrogen only or combination hormonal replacement therapy, or HRTs, have a better impact on a particular type of person at a particular time of their life. We do know that women who start their hormonal replacement therapy within 10 years of their amenorrhea, which means basically when their period stops, or prior to the age of 60, that their sinus symptoms generally are better overall. And that's not true for everybody, but it is true for many. And there isn't good enough research to say, well, if you use progesterone as a part of the HRT, then that will make your symptoms, this particular symptom, better. That's not known. But suffices to say that progesterone is known to have an impact, and it does impact a particular receptor or particular receptors. And you would basically, it's a trial to see if whether or not the inclusion of progesterone in your hormone replacement therapy. And I don't do hormone replacement therapy. Like, that's definitely something that I leave up to gynecologists. That is not my wheelhouse at all. But just to say that to evaluate its impact, the data in human studies are non-existent, and they're only animal studies, really. And so there's a lot of work to be done in that area.
So if we're looking at the impact of hormones, but we're also looking at things like inflammation, and we're looking at the presence of allergens. It would then stand to reason that your normal routine in terms of going through and trying to minimize your exposure to allergens as much as possible would be beneficial, right? Making sure that the dust mites are
absolutely,
fans are clean and the pillows are washed and
absolutely. I mean, the guidelines have remained the same, and they've always been, the first line has always been about knowing your allergens, really, allergy testing.
Okay, so that's going to take us to another really interesting question. I'm going to put that to one side, right? So, and then when you talk about inflammation, does it stand to reason as well that things that will help to reduce inflammation would be beneficial, like quercetin, like NAC, like curcumin, the extract of turmeric? Are these, do you find these things are still beneficial at this stage of life?
Yeah, I mean, I don't have strong data to support it, to be very honest. And I like to know what data I'm speaking about. And I don't have data that says that. But what we do know is if you're taking a holistic approach to it, then avoiding so if there are particular foods that are pro-inflammatory, we know that generally as a group, a lot more processed foods and red meats and so on, burgers and so on, that less intake of pro-inflammatory foods and a greater intake of anti-inflammatory foods. So your fatty fishes and your sardines and your salmon and your green leafy vegetables and so on, broadleaf vegetables, has a positive impact on inflammation overall, and in particular, inflammation that may involve your nose and sinuses. To say that's sufficient to rid you of the issue, I couldn't say that, but it has a positive impact. Always has.
And I know we love to look for magic bullets, but I think what you just said a while ago is exactly, like, hits the nail on the head. There may not be any one thing that improves, but combined, we certainly don't have to suffer. I think nettle tea is also something that is very good at reducing your overall histamine levels. So, from stinging nettle.
Right.
So, yeah. Interesting, really, really interesting.
Well, it's like a two-prong approach if you think about it, Natalie, because if these hormones are imbalanced, it is creating an inflammatory response in your entire body. It's not only into your sinuses. I mean, people get, all kinds of different inflammation response, but being able to know that if you take an approach of supplements, whatever that is, to help with inflammation, to bring that down while knowing your hormone response, your hormone levels, they can come together and work together to be able to bring the inflammation down, which is what you and I have worked together, Dr. Mullings, with me, is really to bring that inflammation down with my sinuses. When my hormones go woo-hoo on me, it's like, okay, let's get into the no gluten, the no dairy, adding in those things. So I think it's important that women realize, as Natalie says, it's not just a magic pill that you're going to swallow. It is many different approaches to bring the inflammation down, knowing that your hormones, okay, need to be adjusted. So I think this is a good segue into what we can do in situations as far as, getting these inflammation response. So we've talked about, which we could talk a little bit with Nats about the supplement side, but for you, Dr. Mullings, what would you say? Is there nose sprays? Is there, I mean, you talked earlier a while ago, there's some medications you took before are actually going to make the problem worse. How do we know if we take an antihistamine, oh my God, it's going to make our mucus thicker? What do we do at this stage? Because somebody had written in here saying that she lives on antihistamines in the chat. So maybe that's making it worse for her. I don't know.
So I think it's always best well, I'm a physician, so it's always best to be guided by your physician. And I think the important thing is to make the right diagnosis. You have to start off right, because oftentimes there are individuals who may have not have allergies at all. And that they may be just having hormonal changes and the symptoms related to hormonal changes, and they may be taking antihistamine for a problem that is eosinophilic mediated. So it has nothing to do with it. It has very little to do with histamines, and so it may not be working. And they may be taking lots of antihistamines and in their menopausal period, and it makes them even drier. And so they're trying to take an antihistamine to reduce the amount of drip down the back of the nose, and it just makes it thicker and drier when actually the moisturization of their nose and sinuses. So appreciating and making the appropriate diagnosis. So there are absolutely things that will help to reduce histamine in the nose if that's the problem. There are mast cell stabilizers or tablets that will reduce the cells that reduce that. So mast cells are the cells that produce or release histamine. And so if you take a tablet that reduces how many of the mast cells burst and release histamine, then you can control the histamine. But you have to identify that this is an allergy in the first place, because it may not be. And therefore, people say everybody has a cocktail that they take. I try to avoid the brand names but we use more the drug names. But unless the pharmaceutical companies are going to get all upset. But in essence, if you're using an antihistamine as a whole group, but you have allergies, it's not going to work. If there is very little inflammation in your nose, but the dripping is due to a leak that may be happening with the brain, the bone that separates the brain from the nose, it's not going to work. If you are dried and you're taking medicines that dry you up more, like Claritin or loratadine rather, it's gonna make it worse. So I mean, you have to appreciate like the impact of the medicine, but know what, because not all sinuses are the same, and not all sinus diseases are the same, and no, everybody doesn't have sinus. That a lot of Jamaicans will say, but oftentimes a lot of people will have. I mean, there are 8 different types of chronic sinusitis, and you really have to make the distinction about which one you're addressing at a particular time.
8 different types of chronic sinusitis. I think he's frozen again.
Yeah, classification.
That's
Oh,
a lot. That's a lot. You mentioned the allergy, like knowing what your allergies are, right? Which alludes to allergy testing. And we've all known that person that's gone to the allergist to get their allergy test, and they come back and they go, well, that's it. I'm allergic to everything. Can you talk a little bit about allergy testing and how useful or overwhelming it might be? Like, how do you feel about allergy testing, and how have you found that because if you know what you're allergic to and you reduce obviously your exposure, then you're helping along the way. But balancing that out with that person that said, "Oh my gosh, the doctor said I'm allergic to everything."
Right.
How do we bridge that divide?
Right. So generally as a group, I think if you're testing food allergens versus environmental allergens, that I'm very cautious about food allergy testing, and because Allergy testing requires interpretation, and oftentimes it does require co-management even with an allergist. And unfortunately, a lot of people may be told that they're allergic to they may have sensitivities to certain foods, but they're truly not allergic to the foods. And then they reduce their diet inappropriately and often lead themselves to malnutrition by cutting out an important ingredient in their diet. Gluten is famous for that. A lot of people would say that they're gluten sensitive or gluten allergies when they really don't objectively have that. And unfortunately, and there are many people who do have that. I'm just saying that the actual amounts and are that people think is there is really isn't borne out in the data. And then there's environmental allergens, and I think allergy testing is I like to see it as a tool in the armamentarium. Just like you have a hammer in your toolbox, but there's a wrench in there and there's screwdrivers and there are other things. It's a tool. It's one of the things that we need to put the information together. And understanding the degree to which you have sensitivities to these particular allergens is important. So making the connection between positivity. So, and there are different types of allergies testing. Some are more sensitive than others. And so I've heard everything from people holding on to a handlebar and it will tell them that they're allergic to everything to, and then there's intradermal testing, there's skin prick testing, there is skin patch testing, there is blood testing that is available. I think what's important to know is that it's the interpretation of the results and it's patient specific that is important. So we often will see a mild sensitivity to cats, or well, I don't dogs or dust mite, but that there isn't a clinical manifestation of that sensitivity. And so you may be inappropriately attributing your symptoms to your dog when it had very little to do with your dog, and that there you are far more allergic to fungus that you might have been exposed to. So understanding the interpretation is critical. I think the skin intradermal testing really does a good job. So you may have a blood test that says, oh, you're sensitive to let's say dust mite and then you do a skin prick and there's a very little reaction there. And so it doesn't mean as much clinically. And so the clinical interpretation of the actual result is what will guide how you go about your life and what you're exposed to and how you should go about addressing your symptoms. Unfortunately, it's not a quick, easy decision. Oh, this test showed this, and therefore it must be that. No, not at all. And people have gone as far as to, doing vaccine testing to determine responses and so on. So it's a whole specialty, and there are people who spend their lives doing this alone. So I mean, it does require a lot of thought and process and work through.
Well, I think for me, what I'm getting from this as well is that because we are going through so much change now in our perimenopause and menopausal years, that maybe when we did allergy testing, perhaps you did it 5 years ago and you were told you were allergic to or sensitive to X. When you're during your menopausal journey, then I'll just call it, it's changing again. So
Yeah.
I think it's important that we zone in on what's happening to our bodies right now, not that we were told 5 years ago that we were allergic to tomatoes, so we've cut out tomatoes for our entire life. Now in our menopausal years, tomatoes may be the best option for us. So certainly when it comes to this stage of our lives, I think it's important that we act on the symptoms that we're having right now, that if you find that there are changes with your sinuses, inflammation, all of these other things, that you really pay attention to that and go into it. So the changes that are happening. I think somebody has just typed in the chat. So Dion says, my sinuses and allergies have certainly changed since menopause. Same with me, Dion, is my allergies and sinuses have not so much allergies, but sinuses definitely did a 360 without a doubt. And being able to go in to Dr. Mullings and identify through a scan, your sinuses are clear, as you said, but I was living on antibiotics was ridiculous. So being able to do that, I think is really important that ladies, that you're in this stage of be focused. So let's talk a little bit about, well, we talked a little bit about natural functional medicine, like supplements and stuff, but like sleep and all of these other things. Would you say that those can affect your sinuses, your breathing techniques at night, the room that you sleep in, all of these things, those factors? Would you have any recommendations on those?
Yeah, well, just outside, well, so sleep is important. And we do know that lack of sleep is a stressor, and stressors are associated with pro-inflammatory states generally. We do know that if you have allergens in your bedroom, that will worsen your symptoms. We do know that adequate hydration, because when you're in menopause, you're a lot drier, hydration actually helps the health of your sinuses. So we do know that the types of foods that you eat, and certainly healthier foods make a big impact on your overall health, not only of your sinuses, but generally you in total. And we know that exercising actually improves your not only your mood, which can, as you certainly everyone would know, is impacted in your perimenopause or your menopausal journey, your transition and menopause. And but certainly with increasing endorphins, and but also we do know that overweight individuals and will have a greater propensity to a lot of the symptoms. So obesity in and of itself is a pro-inflammatory state, and it triggers a greater amount of inflammation, and we do know that it makes disease states harder to control. And so anything that reduces that makes a positive impact. And we do know about even the impact of hormone replacement therapy. And we are finding that obesity with hormone replacement therapy in the perimenopausal state, that it makes symptoms that are harder to control in obesity. We do know that hormone replacement therapy actually helps to reduce, interestingly, overall weight in some individuals or in a group of individuals. And so that also actually helps their symptoms. And so there are lots of things that you can do. Certainly eating a healthy, balanced diet will reduce the amount of trans fats. So for example, processed foods that you eat helps in creating a better balance in inflammation. So inflammation is not all bad, it's protective, but also anti-inflammation is good, and you need to get the balance. And when you have imbalance is when you have dysfunction.
So there's natural stuff you can do, but from what I'm understanding from you, with the imbalance of the hormone, we talked about estrogen receptors. For some women, you can, I want to just get this right. For some women, they have more of more mucus producing, and some are less mucus producing.
So what happens is that your estrogen impacts the density, the amount of receptors that you have.
Okay.
And your progesterone impacts that as well. And as well as there are some individuals who, and therefore a change in the amount of stimulants, so the estrogen and the progesterone actually impacts how thick and the mucus is and so on. So we're also, well, women are also susceptible to those changes. And so that's why many of them during pregnancy gets congested and so on. And during menopause, they may get thicker, not as congested, but they may drier. The congestion is not due to swelling as much as it is due to a dry, thicker mucus and so on. So congestion in and of itself is not one thing. It could be due to the turbinates being really swollen, or what we call the septal swell bodies being particularly reactive to the changes in hormones. And then, you know, the way in which the hormones change differs too. And so the concentration of each particular hormone is different. And that's why there's hormone testing and looking at their FSH levels. And certainly that's something that your gynecologist will work through. That's not something that I do much of at all, but we are aware of that impact. So it's important to understand that that balance changes in particular people. And whenever you have a great amount of estrogens and so on, you may get thicker secretions versus you have less, you have a not thicker, more water, but more congested. But then when you have less, it's drier and thicker, not as swollen, but certainly that doesn't mean that you're not congested. So congestion, it could be due to a number of different factors.
So, something that just came to my mind was for the women who can't do HRT, who are not able to for various reasons, and they are suffering and they're having these recurrent sinus pressures and pains and stuff. How do you help somebody in that situation?
So, something as simple as saline rinses have actually been proven in great studies, what we call level 1 studies, to actually improve symptomatology or your symptoms associated with the dry secretions. Hydration of your nose also makes a big impact as well. Just using avoidance of your allergens and so on. So a lot of these hydration of the nose with using topical emollients, is what you call them, but basically water-based gels for your nose that help to keep them moist and so on. Huge, not to be sneezed at all, but major impact that they can help in your symptomatology. I'm not advocating that everybody should be on HRT at all. It's for the person and based on their risk factors. And certainly with a discussion with their gynecologist about their particular risk with this condition, with this life stage. I don't like to think about it as not a disease as much as it is a period in your life that all women pass through. And so appreciating that and knowing that HRT is just a tool in your armamentarium, but there are other tools that are available, natural ways in which has been shown to impact symptoms. May not be to the same degree, but it has an impact.
Okay. Well, I think it's also about knowledge. I think it's about learning what is going on with your body at this time, the inflammation and how it's affecting your body, and have your levels tested, whatever that is for you, and having a discussion, with your ENT, to find out what's really transpiring here, with the sinuses. Because I mean, would you say in your practice, have you seen more women coming to you with, I mean, I came to you, a couple of years ago, saying, listen, this has got to be menopause. This has got to be my hormones. Are you seeing that happening more and more? Or it's
No,
not really?
yeah, not a lot of people, I think, are expressing that they think it's due to menopause. Unfortunately, I think they may be going through that, but may not be making a connection, or are they're what they think may be they're in ENT sometimes. People ignore a lot of these symptoms and focus on things like they may be having heart disease or an autoimmune condition, or they're just a varied number of different stressors that they may be going through that may focus their attention on. But definitely I see more and more people coming aware. They may not attribute it to menopause. And certainly we do know that sinus disease is more common in adults than in children. And we do know that the age group for this condition is, in their 30s, 40s, 50s, that they may have chronic sinus issues that are becoming more and more unbearable. But yeah, so we do see people in that age group. We appreciate and we know and we manage that as well. But I wouldn't necessarily say that many people are aware and are coming in to say, boy, my menopause is having this impact on my sinuses, and I need to address that as much as it is having an impact. And we always have it in our brain to say, okay, we need to make sure that we help to address that component to achieve success.
Okay. Well, I know what was really helpful for me when I was going through it was when you're going through any kind of sinus issue, you're convinced you have a sinus infection, I gotta go on antibiotics, and going to an ENT or your ENT, they're the ones who are going to be able to really look in and say, okay, it really is truly an infection, or it's just this producing of the mucus or the dryness of the dry nose or whatever, and let's try, going through that route, which, as I said, was extremely helpful for me, and that's how I've been able to maintain my sinus health, in just knowing that, having that natural way of, I don't have a sinus infection. I mean, currently I'm going through something now because I know my hormones are off. And I'm not running to Dr. Mullings saying, oh, I have a sinus infection. I am doing it through, saline and flushes and stuff. So that puts the power in our hands as women that we can actually do something about it and create awareness, to say, listen, we don't need to suffer. And a lot of women, as you started off by saying, is that there's not a lot of research done that this actually does affect the sinuses. I mean, when I first told people, people laughed at me.
Yeah, yeah.
Menopause and sinus? Are you for real? And I'm like, yes, for me it was.
Yeah, yeah.
So I think that that's important. So I know you're a busy man, so I won't keep you much longer, but if you had to give ladies one big juicy piece of advice in this stage of their life, going through struggling with their sinuses, what would you tell us?
One of the advice I would give is, just be aware, be open-minded, read about some of the things that are going on, but don't be afraid to come and talk about some of these symptoms that you're having. Um, their physicians generally have an open ear to appreciate what's going on, but also just know that there are tools, and they're not all hormone replacement therapies. That's not the only tool. It's just one of the tools that we can use to alleviate your symptoms and to return you to a better quality of life. Because it's absolutely possible. You don't have to live with sinus. It's not incurable, and it's not I think people underestimate the negative impact it can have on people's quality of life, and really how it impacts how they go about their work or their social activities, and it doesn't have to be that way.
I think that's really powerful. We don't need to suffer. Absolutely not. Nats, you have anything you want to share before we release Dr. Mullings? I know he took some time out of his, what is it, clinic or whatever today to share with us. So I so appreciate
No,
you
I'm
giving
really
us
happy for the
juicy info.
conversation.
Yeah.
Yeah, no more
Thank you,
questions.
guys.
Other than just to say that when I see my clients, allergies is one of the things that tends to go off the charts as we get into this stage of life. So just continuing to create that awareness is important. And thanks for what you're doing, and thanks for being here with us today, Dr. Mullings. Really appreciate it.
Thank you for having me. It was a good time. Thank you.
Great. Thanks, Dr. Mullings. Everybody have a wonderful day, and we'll see you on the next Menopause Monday.
Bye,
All
guys.
right. Bye.